Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Kerry Reller, and today we have a returning guest all the way back from episode 15, Dr. Hayes Estes. Welcome to the podcast.
Yeah, thank you.
Briefly, let's hear about, who you are, what you do, because that was a big thing that we focused on last time. So tell me about yourself.
Real quickly, I'm a doctor of physical therapy. I'm also an orthopedic clinical specialist. Essentially, I have my board certification in orthopedic physical therapy, and I'm the owner of Premier Physical Therapy with our main office in Clearwater, Florida. And since the last time we talked, we've moved our satellite office to Tarpon Springs. So we have two offices, and we specialize. What we like to say is we help athletes of any age or ability level get out of pain and get back in the game. And I think the key thing that I wanted to talk about this time is the definition of athletes. And I put athletes in quotation because yes, we see a lot of competitive athletes, but we see people of any age here at the clinic. And so that's who we are. That's what we do. And if you're in pain and you want to be able to exercise and be active, we would love to work with you.
Yeah, it's so true. I think one of the patients, mutual patients of ours, I think that you sent me was 90 something. So, and he was a new patient and you were working with him and he was doing great and he like spoke highly of you. So, any age, like you said, is an athlete. So, I think you want to talk about kind of training smart as you age. I don't know what age group you want to start with, but why do so many people in their 40s and 50s feel like they can still train like they're 20? And what are the risks of doing so?
Yeah, so one of the stats that we mention often in the clinic is that 77% of this country is not meeting the minimum recommended guidelines on a weekly basis for exercise. These guidelines are in place to help stave off systemic conditions, diabetes, high blood pressure, upper respiratory infections, some types of cancer, to help with those conditions. And we don't want pain to be
Mhm.
that people cannot exercise. So that's why we do what we do and that's kind of our why is so that people can exercise so they can stay longer here on this planet and enjoy their time on this planet. And so the analogy that we like to use is that you have a financial investment that you make in your retirement. You should also be making an investment in your health, a health investment, so that when you get to that retirement age, you can enjoy it. And so laying the seeds now kind of bear the fruit later in your years. And so I think you kind of asked why people in their 40s and 50s think that they can exercise like they're in their 20s. And my response to that was that I would rather have people like that because it's a lot easier to kind of rein someone in than it is to poke and prod someone the other direction. And so we just want to promote the idea that you should start now investing in your health future.
Yeah, and you can start at any age, right?
Correct. You can
Yeah.
start at any age. I don't want it to dissuade anyone. I don't want someone to think that, oh, it's too late for me. You definitely
Mhm.
can, but it's kind of like, the benefits may not be as grand as if you start investing in your, 20s and 30s, as you start in your 50s and 60s. So you can still very much enjoy your later years. I would just encourage people to start sooner. But to your point, there are several studies out there that look at people in their 90s who have never embarked upon any sort of formal strength training, and they start some formal strength training, and they not only do they get stronger, they actually can put on muscle mass in their 90s. So you can get big muscles even in your 90s.
I'm reading Peter Attia's Outlive book like right now. We're literally on this chapter, and I'm not so great at quoting the, statistics either, but he says like you lose 7 to 8% of muscle mass like, per year over, a certain amount of time. So obviously his argument is also starting younger, right? And it's important for everything that you said, like those cardiovascular metabolic problems, but also not falling down and not being able to get back up, having a fracture and not being able to recover from it, and, everything else as well. All the things that you want to do throughout the day, like through your entire life, you need to be having, strength, right? And it is sad that we have, as a society, not been as active as we had once been as, humans. But we have these guidelines in place, like you said, right? But nobody follows them. And interestingly enough, when I was a resident, my study was about do doctors like follow what we preach? Like, so basically, what are our physical, how much physical activity are we actually doing, and it was in the educational setting, unfortunately, meaning the people who were teaching me and things like that. So they probably even have less time to exercise and, work out and things like that. So, but anyway, that was my research study was basically, are we practicing what we preach and are we following those guidelines? And sure enough, we weren't. So, so how
Yeah.
do we do better? Like, what can we do?
Well, to clarify what the guidelines are, because
Mhm.
I think that people do get overwhelmed. They think they have to start working out 7 days a week. You do not have to work out 7 days a week. So the guidelines are either 150 minutes of moderate intensity cardiovascular exercise per week or 75 minutes of high intensity cardiovascular exercise and 2 days of moderate intensity strength training. So, they all kind of go hand in hand, but realistically, if you're exercising 3 to 4 days a week, you can easily check those
Mhm.
boxes. So what was the question again?
I don't know, but I think that's good to
So,
go over
yeah,
because there's, like you said, there's time recommendations based upon the intensity level, right? So
right.
you can be more efficient if you work out a little bit harder and work out a little bit less often, or you can be doing your walk and you can, enhance your activity if it's a walk, right? You could
Right.
wear a weighted vest, you can walk faster, you can walk uphill and all things like that to make it more intense, and then maybe the time can be cut down, right?
Yes. Yeah. So that was the question. The question was, where can we start? Right. So people who
Mhm.
get overwhelmed, they think that they have to start to do 180 degrees the other way. Start with something simple, like a 10 to 15 minute walk, right? And
Mhm.
so you can just you walk around your house, you walk around your block. And then in terms of the strength training, you don't necessarily have to go to the gym. Moderate intensity, there's a reason that they did not put numbers on the intensity and it's moderate or high intensity. And that's really up to each person. So we will often use what we call rate of perceived exertion in the clinic, or even something what we call reps in reserve in the clinic. And that can be for anything that we do. So, the things, yes, I see people who we're doing barbell back squats. I also have patients who are doing sit to stands. Guess what? Those are both squats, right? And so even with something like a sit to stand where you sit in a chair and you stand up and you sit down, you can do that and make it moderate intensity by going to the point where you've got about 2 or 3 reps left in the tank. And that's a good moderate intensity. And that might be 5 reps one day, that might be 10 reps another day. Hopefully in time that increases. But that's a way to get moderate intensity strength training with someone who doesn't have a gym, they don't can't get to a gym, and they're not sure what to do. You have a chair at home, we can start with a chair. So we want people to embark upon what we call progressive overload. That's a way that we can make ourselves stronger. And in a nutshell, that means little by little over time, we're doing a little bit more. In the weightlifting community, that is adding more weight.
Mhm.
However, not everyone is a weightlifter. Some people just need to get stronger and need to be able to get on and off the toilet a little bit easier, which is why the sit to stand is a fantastic exercise that we use, and it's along the lines of a squat pattern, right? Some people kind of get a little funky when they hear the word squat. So how do we get someone to a moderate intensity level on something like a sit to stand? Well, we can use what we call rate of perceived exertion or RPE, but sometimes people tend to kind of underrate that or overrate that. So people tend to kind of overrate it if they are new to strength training. So they may stand up and sit down 10 times in 5 seconds, and they may say that that was a 10 out of 10 difficulty. Well, obviously it wasn't really 10 out of 10 difficulty, because 10 out of 10 means you could not have done any more. So
Right.
oftentimes what we use in the clinic with our weightlifters or our non-weightlifting patients is, how many more reps do you think you could have done? And that's called reps in reserve. And so the reason we ask that is because it has a counterpart to, or correlation to, RPE. So if, for example, that person who did 10 sit to stands in a matter of seconds, if I asked them, hey, how many more do you think you could have done? If they said, oh, I easily could have done 5 or 6 more, well, the counterpart on the RPE scale is that would be a 4 to 5 on the RPE scale. The reason I bring all that up is because in the weightlifting community, or the way that we can get stronger, is if most of our workouts are around a 7 or 8 RPE. In other words, leaving 2 or 3 reps in the tank for every set, you're checking the boxes. So that is reps in reserve, and that is how non-weightlifters can progress themselves and make themselves stronger with every single time they're doing a workout or doing an exercise on each set, they leave a couple reps in the tank.
Yeah, I've never really, while I do all of these things, I've never really considered like weightlifting having like a different intensity as well as, I always think cardio with a different intensity. So this is really even educational for me, even though, yes, I do these things, when I'm doing weightlifting. So that's a very interesting way to obviously look at it. And I know that that is common in the weightlifting community, but it seems like that you're able to integrate no matter what level the patient is at and, create exercises for them that would be something that they can continually build upon, correct?
Correct. Yeah. So things like the squat and the lunge, right? Even the deadlift, these are fundamental movement patterns, right? So if I want to bend over and pick up, my kitty litter, that's a deadlift, right? If I'm going to kneel in the garden and then stand up, that's a lunge, right? You mentioned falls earlier. If I fall on the ground, one part of getting back up is to get to a kneeling position, which is then a lunge. So, we want to train these patterns. We don't want to scapegoat these patterns as dangerous, and I definitely don't force everyone who comes into my clinic to put a bar on their back or, pick a bar up, right? But we do teach them how to bend over and pick something up properly, teach them how to stand up and sit down and so on and so forth. And so, and that's why I keep coming back to the comment of, hey, we athletes of any age or ability level, we're all athletes in some fashion, and we should aim to be athletic.
Absolutely. What you mentioned the fundamental movements. Can you like go through all of them? Besides,
Sure.
we talked about, the squat, but yeah.
Yeah. And there's some variance here a little bit, but it's, a squat is a fundamental movement pattern. A deadlift or a hinge, bending over and picking something up. A lunge, right? So you're on kneeling on one knee, one foot's on the ground. And standing up, that's a lunge. Pushing and pulling. So that's whether you're pushing straight out in front of you, pushing overhead, pulling straight out in front of you, pulling from overhead. And then I also like to include some form of a carry. I'm carrying some sort of weight, and I'm walking back and forth, whether in two arms or in one arm. Those would be fundamental movement patterns.
Yeah, I'm like I said, I was reading that book, so I feel it's like all in my head right now. But he mentions like carrying like, 230-pound weights around and, working for that. But he's also talking about grip strength a lot. I have a grip strength tester in our office. I can't say I use it enough, but do you have any comment on grip strength?
I mean, it's important. It's definitely important. So there's a relationship. I'll use that term between grip strength and mortality. So there are several studies out there that people who don't hit a certain threshold, their mortality rate increases. I don't want to scare anyone. You don't have to go out and start deadlifting twice your body weight right now, but it's important. And since there is a relationship, all right, let's work on it. We have a handheld dynamometer in our clinic as well. We use it often. And so I would encourage people to work on grip strength, just again, not just for mortality rate, but for functionality as well. So the exact amount, I mean, there's some gray area there. I mean, there's a recent study that came out that showed that you should be able to hold, half your body weight in each hand for a minute. And that's pretty tough. I mean, I weigh about 215 pounds. So, that's over 100 pounds in each hand, and I can kind of get there, but it's tough. So, and I'm, last time I got my blood work done, I'm a-okay. So point being that it's not a black and white, there's always gray area. If you feel like you're lacking in your grip strength, let's work on it.
I will admit, mine was not as impressive as I thought. And I consider myself a very strong female and I work out a ton, and my grip strength is kind of not so good.
Yeah.
I mean, it was average. It wasn't like low or anything. I can't
Yeah.
remember the number to be honest, but I haven't tested it in a while, but it was not as good as I had hoped. Let's just put it that way.
Yeah, what I would say is that, we do a bunch of tests in the clinic, but we never hang our hat just on one finding. And so if we find something, we want to maybe improve it, we think it's related to why people are in the clinic, yeah, we'll work on it. But I say this to anyone who walks in, including myself. I can nitpick anyone who walks in the clinic. I can find things on myself physically that I need to improve upon. Whether or not they're affecting my ability to do the things I want to do, or they're affecting my pain, is to be determined.
Hmm. Hmm. What would you say to people who are worried about like thinking exercise is dangerous or anything?
It depends on how cynical I want to get, I guess. What I mean by that is, so we do get people who, have been told by, maybe some healthcare practitioners, or, oftentimes they found it on the internet that, hey, like deadlifts are bad for the spine, deep squats are bad for the knee. And what I would say is that in terms of research, we don't again, kind of like, we don't hang our hat on one finding in the clinic in terms of testing. We don't hang our hat on one research study either. So the collective whole of the research is pretty abundantly clear that these movements are not inherently dangerous, that no exercise activity position that we do is inherently dangerous. With that said, anything can become painful or sensitized if we do it too much, do it too soon, do it too fast, load it up with too much weight. And that's our job as physical therapists, is making sure that it is appropriate for you, and that we do progress it in a controlled fashion. But I guess quickly, from the cynical side, people who think that squats are bad for their knees and their knees shouldn't go over their toes when they squat, I would ask them how they go up and down stairs. Because I would like try to go downstairs without having your knee go over your toe and see what happens.
Mhm. What is the biggest myth about exercise kind of after 40 years old?
I guess what I would say is that you that well, I think I got so many in my head. Well, coming back to your statement before, your question before, why do 40 and 50-year-olds feel like they can or should work out like they're 20? And to your point, we probably don't. But what I mean by that is, I don't mean that we should drop the intensity down on everything that we do. What I mean by, hey, we probably shouldn't train that way, is the recovery time. And so we do know that, yes, we do lose muscle mass after a certain age. We stop producing as much testosterone, growth hormone, past a certain age. And those are the hormones that we need to recover after we work out. So, when we do resistance strength training, essentially what we're doing is creating micro tears in the muscle, right? And then our body repairs these and makes our muscles bigger and stronger and more resilient. The way we do that is via hormone production. Hormone production plays a massive role. And so if we're not able to produce as many hormones, or at the same level as we were when we were 20, probably don't want to go and work out to a 10 out of 10 intensity every single day in my 40s and 50s, because the likelihood that you're going to recover is much smaller. I don't want to discourage people in their 40s and 50s and beyond to work out with intensity. I would just kind of pick and choose your spots, and not definitely don't do it every single time you go to the gym, like you probably could when you were in your 20s, because it's the recovery that's the issue. And so the hormone production or lack thereof is going to play the role. As we age, we don't produce the amount of testosterone or growth hormone needed to recover. So testosterone plays a role in muscle synthesis and production. Same thing with growth hormone. So if every single time you go into the gym as a 40 or 50-year-old, you're trying to set a PR, you're trying to go, all out, probably not the best recipe for success.
Do you have any patients that are on like testosterone replacement therapy that would say that they are able to do these things a little bit better, like and recover better?
Short answer is yes. With those patients, I say, all right, I mean, it's your body type of stuff, right? So, I mean, I don't want to speak outside of my scope of practice. This is more of my personal knowledge, right? So you can obviously, as a medical doctor, can please chime in. But with hormones, right, especially with these exogenous hormones, if the more that we take them, I'm assuming that the likelihood is that your body essentially starts to realize that, hey, I don't need to produce as much on my own because I'm getting this source, right? So at what point do we stop with taking these hormones, or can we? And so that would be my hesitation with those patients, and maybe people don't care.
I
And
wasn't really referring to patients that are
okay,
using it for like bodybuilding purposes, but more
got
for known to have a lower, like just like, a medical cause. And then perhaps, they want to start working out. They don't have the energy to work out. We do replace the testosterone, and then they would probably have better opportunity to have good, exercise, physical improvement, become stronger, So it's a big difference from what, I'm just saying like someone's trying to use it for like a competition, or I know that's
yeah.
illegal, but in that kind of report. So,
Yeah, I mean, in that instance, well, yeah, well, so again, I answer the way I answer because we do see a lot of those type of athletes, and so that's probably the more common. Although we obviously see people who, for medical reasons, have been prescribed because their medical doctor has determined that, hey, you need this if you want to function. And so what I would, even then, I would still encourage those people to use, hey, this newfound hormone production or hormone levels, and take advantage of that, because then that might be something where you can kind of kickstart your own body to start producing some more as well. So,
well, no, you're right about that. Like basically, if you replace it, it does turn off, your body's, I mean, it can turn off your body's ability to use it, and therefore you may need to be on it kind of forever. So it's something to think about before starting any hormone replacement, obviously. But I think we're getting off topic. So what else would you like to share about kind of being fit as you kind of age?
yeah, I think the big picture is, coming back to those fundamental movement patterns, and just making sure we kind of check the boxes, and that that a couple days a week, doing a couple full body exercise routines. Maybe you're taking about 45 minutes, give or take, with those, and that'll check the boxes if you're doing those movement patterns. And we talked about before how to make them to a moderate intensity at least. And I mean, those are the main things. And then checking the low hanging fruit. So what I mean by that is, are you getting enough sleep? How's your nutrition? Right. So let's make sure that we check off those easy boxes first before we start worrying about other things that could be contributing to your pain or your plateau and performance.
Mm. I would say, what other benefits from, incorporating strength training have you seen for your patients? Like, what have they said that also is better?
Yeah. Well, so in terms of the physical, right? I mean, bone density is a big one, right? So especially we talk about females past a certain age. I mean, males as well, the bone density. And then you mentioned before about falls. We know that falls with a fracture of the femur or the lower body past the age of 80, mortality rate kind of goes through the roof, right? So if we can improve strength and balance and bone density by strength training, right, then we've helped ourselves out a lot. Just general confidence. So again, as we age, a lot of people, they stop being independent, maybe because they aren't sure that they can do the things they used to be able to do. And strength training is a great way to improve that confidence of, oh, I can pick this bag of kitty litter up. I can take my garbage out to the street and bring it back in. I can carry the groceries in and out of my car. I can go upstairs and I don't have to worry about that. So confidence is a huge thing. So if we lose that as we age, it's kind of a slippery slope. And so one of my favorite patients we worked with, maybe it's been a couple of years now. So she had a knee replacement. She was so hesitant and fearful of falling that she stopped doing anything. She used to love to go to Zumba, and she would go to the Y, and there's some classes at the Y. She just stopped it all after the knee replacement. Her knee was fine. She had great range of motion, but she was so fearful of what could happen that she just didn't want to go through the trauma again. And so I remember the day that we basically got her, because we worked on lunges first. We worked on lunges, we gave her a couple of things to hold on to, and then we worked our way down in range of motion. And then we got to the point where we actually had her practice lying on the floor on her stomach as if she had fallen. And then had enough strength to get to a lunge position, and then she stood up. And the look on her face was, I mean, that's why I do what we do, is she walked out that day, and she gave us the biggest hug, and she's, man, y'all are awesome. And that's really it right there.
That's amazing. So tell me this. We have, as a primary care doctor to do Medicare annual wellness visits. And these visits are usually for patients 65 and older. And I have been thinking of like putting in our order set so that almost everybody gets the opportunity, and it reminds me of having like a referral for physical therapy so that they can work on whatever we want to call it. And I guess the question is, what do we call it? Like deconditioning, balance issues. But I think these are things that they could use, utilize their insurance for, and, benefit in strength training, balance improvement, fall prevention, and like you mentioned, bone health as well. What do you think?
Well, I mean, it's teed that one up for me. But obviously, I think it's important. I mean, confirmation bias at its finest, right there. Yeah, I mean, you have Medicare. It's one of those things where if you don't use it, you lose it. Not the physical, but like the Medicare, you like it's paid for. So why not, right? And so I mean, I guess I'll talk a little bit about how we do things so people don't think that I'm a snake oil salesman. But we see people once or twice a week with Medicare. We always do reassessments every 30 days, and if we have achieved our goals in that short period of time, or even less, then we're done. We're discharged. People don't sign up for contracts. We don't force them to come in 3 or 4 times a week just because we can charge Medicare. This initiative they started probably a couple of years ago, where it's a different, documentation on our end, but yeah, they reimburse for maintenance therapy. I don't know why I use quotations. It's actually maintenance therapy. So for people who essentially don't have the resources to go to a gym, and they need the physical therapist to take them through.
So if patients want to start to exercise, right, it's a great way to get their primary care physician at that age, right, to, learn a couple moves, like the foundational movements that they can do at a physical therapist's office under supervision, and then kind of go out and transition into a community setting if needed, especially if it's being covered by insurance. And it should be, because my goodness, what benefit can they get from it, right?
Right.
Amazing.
Yeah.
Yeah. Well, any final thoughts, Dr. Estes, that you want to share with us today?
Yeah, the main thing I want to say is that it's easier than people realize to get started. The joke is, or the analogy is, how do you eat an elephant one bite at a time, right? So just start putting one foot after the other, and we're here to help. That's what we do. And so, think of your financial investment and your health investment as the same. If you want to enjoy those later years, start laying the seeds as soon as possible.
That's a great analogy. Yeah, I love it. So where can people find you again? I know you kind of said it in the beginning, but
Yeah. Yeah. So our website is ptandsportstherapy.com. Premier Physical Therapy is the name of my office. Again, we're in Clearwater and Tarpon Springs. If you want to find us on Instagram, we are at Premier PT Clearwater. That's where we are, and you can find us there. And yeah, we happy to be in the area. Love supporting this area. I've been in this area for about 13 years now, and love Tampa Bay.
all right. Well, thank you so much for being a guest, and I appreciate your time today. Thank you so much, Dr. Estes, and everybody stay tuned next week for next week's episode.